Good morning, everyone. Welcome to this session on reviews of DTA and prognosis studies. I'm Julie Glanville. I'm an independent healthcare information consultant, and I'm a co-convener of the Cochrane Information Retrieval Methods Group. I'm joined this morning by Anna Knowles-Storr and Lise Escort, and I'm going to ask Anna and Lise to introduce themselves. Anna, would you mind introducing yourself?
Absolutely. So I'm Anna Knowles-Storr. I'm an information specialist with Cochrane. I've been working with Cochrane for, I think, 12 years now, and I'm based in the Cochrane Dementia and Cognitive Improvement Group at Oxford. I'm also on the Cochrane Information Specialist support team, and I work also on the Cochrane Crowd Initiative within Cochrane.
Lovely. Thank you, Anna. And Lise?
Hi, I'm Lise Escort. I'm not an information specialist. I'm a haematologist based in Oxford and coordinating editor of Cochrane Haematology, where we've done multiple prognostic reviews.
Thanks very much. Sorry, I'm just mastering the clicker. Okay, welcome to this session. We're going to cover an awful lot in the next hour. We're going to divide our time equally between looking for identifying DTA studies and identifying studies for prognostic reviews. And we're going to look at issues around how searching might be different for these types of reviews. So when we're thinking about the searching tasks involved in systematic reviews, we usually think about dividing up the tasks into developing the search strategy, so thinking about the search concepts that are involved in the search terms. So we'll look at those issues briefly today. And then also thinking about what resources we will search to try and identify those types of studies. So what databases and other information sources are going to be useful for finding DTA studies and prognostic studies. So we're going to start by looking at diagnostic test accuracy studies. We're going to briefly review what DTA studies are, and then look at the challenges of finding them in information resources, thinking particularly about search terms, but also the conceptual breakdowns that we might use when we're structuring our searches. And then we'll also think about where to look. I wanted to highlight before we begin that Cochrane has already prepared a lot of guidance and training on this topic. So there is the Cochrane DTA handbook, and there's a link to that on the slide there. And there is also a lot of Cochrane training available, very useful videos to watch, which are at the link there. So there's lots of material already available to help us get to grips with the searching aspects of DTA reviews. So I thought we would start just by looking briefly at what diagnostic test accuracy studies are. These are studies that evaluate how well a test performs in detecting or excluding a condition of interest. So DTA studies might look at a whole variety of tests. So these might be anything from examining patient characteristics and history taking through to questionnaires, physiological measurements, lab tests, all sorts of imaging, and internal techniques such as endoscopies. So when we're thinking about searching and when we're thinking about our review question, we need to be aware that the definition of the test itself could cover a whole variety of fields, and the language that we're going to use for some of these tests might be more or less focused. So I thought we would begin with a few minutes of just thinking about what searches for DTA studies might look like. And I thought we could think about what would the PICO look like for a systematic review of DTA studies, and what we think the search terms, what we think the particular challenges might be of identifying the search terms for DTA studies. So we can't hear you, unfortunately, but you are able to put thoughts and questions into the chat. So if you've experienced doing DTA reviews, or you have queries about DTA reviews, then it would be really nice if you could put those questions or observations into the chat. If you could make sure that you have your name and also your role within Cochrane, or your professional expertise in the question, that would be really helpful as well. But just thinking now about how you might structure the search for a DTA review, and what you think the challenges might be about identifying the search terms. So whilst you have a think about those questions, sorry, I'm just getting up the questions so I can see the questions as well. Somebody's saying, thank you very much, that newcomers might not know what PICO means. That's very true. Apologies. So by PICO, we mean the research question that we are trying to answer in the systematic review. So in reviews of effects, the PICO stands for patient intervention, comparator and outcome. And in a diagnostic test accuracy review, that question breakdown might look different. And so this is a chance for you to speculate on how it might be different, or give us your experience of how the PICO has changed for a DTA review compared to a review of interventions. So the PICO is the structural breakdown of the question, the review question that you're trying to answer, and the concepts involved in that question. So while we wait for more observations and questions about PICO and search terms, Anna and Lisa and I will talk briefly about our experience of preparing DTA search strategies.
Yeah, I'm happy to give my thought. Yeah, exactly. While you look at the questions, I think, so for me, I tend to take a general approach when I am presented with a DTA search to construct, which is to keep it obviously as sensitive as possible. And my initial approach will often be to see how just a two-concept search looks. And the two main concepts that I would most likely focus on for a DTA search would be the index test and the condition of interest. But, lovely as that might sound, very often that will yield a huge number of hits. So, for example, if my index test is the mini mental state examination, which is a sort of very common test in dementia, and I sort of combine that with my dementia terms, I'm going to end up pretty much retrieving almost everything that's ever been written about dementia, because there are very few records that don't mention the mini mental state examination at some point, whether it's as part of the criteria used for the selection of participants in an interventional trial. So start sensitive, but be prepared to have to really think how you can bring in some level of specificity to your search, because otherwise it's potentially going to be fairly unmanageable. And I think we'll probably come on to talk about how you might want to introduce use of a filter potentially, but not in a way that limits your search in an overall way. So I think that's my sort of first observation. I don't know if you can relate, Julie or Lise, or if you have other thoughts.
Yeah, I think I'm just, there's a question about search filters here.
Yeah.
Saying, would it be sufficient to use the population and filter by study design? And I think as you're already saying, Anna, I think that's probably one approach, but not the only approach.
Yeah.
There's a Cochrane review of the performance of DTA filters, which sort of comes to the fairly clear conclusion that just bolting on a search filter to a search, so say a disease, an intervention, a topic is just not going to be sensitive enough for systematic review purposes, but it might be useful as part of a series of searches.
Exactly. Quite often what I'll end up doing is running what I call a multi-stranded search, which is essentially a number of different searches within one search strategy. And so at the end, instead of anding all your concepts, you're actually oring your separate little searches that you have run within that one big search. And one of those searches might indeed make use of a methodological filter, but other aspects of it, perhaps where you've focused a bit on key aspects within your index test or your condition of interest, you haven't used a filter there, so you then combine at the end. And that might sound all a little bit complicated. It really isn't, but it is a departure from how we would normally do construct a search for an interventional review.
Thanks. Well, while we've been talking, thank you very much. People have been sending us through observations and questions. And so we've got an observation here from Samantha Cox. She's saying, I often find that the terms that refer to the tests are referred to in passing in every study on that condition. So it's a bit like you were saying about...
It's exactly the same. Yes, I can very much relate to that.
Yeah, and so she's commenting, an MRI is a very common test that might be used to define a population in an intervention review, not just a DTA review. So thank you for that, Samantha. Naomi Merriman is saying... research question, what is the test accuracy of index test in diagnosing contemporaneous condition? So I think that's a suggestion about how you would structure the question, I think, Naomi. And then Yori, I'm very sorry about this, I'm probably pronouncing your name totally incorrectly, but Yorian Lehrmans is commenting that the search depends on the number of hits, start sensitive, but go more specific if necessary, which I think is, Anna, you would...
I really agree with that. So start sensitive, and if possible, and this applies, obviously we'll talk more about prognosis studies later, but if you can have a validation set, so a set of studies that you would expect to be retrieved by your search, use some of that to help develop the search. Put some aside if you can, and develop your search and take the most sensitive approach. Test to see that it retrieves all that you expect it to. And once you've sort of achieved that level of recall that you want, start to then work on how you can improve the specificity if that's necessary. I mean, you might end up that you achieve the recall and you're only retrieving sort of 2,000 or so hits, but that's incredibly, I think, unlikely with DTA searches. So, yeah.
Thank you. More questions and comments here. So Kit Byatt is commenting on a PICO structure, suggesting the P is the condition, the I is the new test, the C is the gold standard test, and the O is the diagnostic accuracy, which I think is probably pretty much what we're going to suggest in the next slides. I think that's good, Kit. And then Renato Nietzsche, I usually search for the index test that we want to know about, diagnostic accuracy, population and outcomes. So again, very similar. Carmen Andalucia. So Carmen is agreeing with Renato, but she's saying with index tests and condition, you could find a lot of studies, and you can find a lot of studies without sensitivity, specificity data, or index tests used in basic research. Yeah, so absolutely. I think what Carmen's saying there is obviously the general noise that we get no matter what topic we're searching for as well. I think these are things you find in effectiveness reviews as well, isn't it? There's always those studies where the topic is mentioned in passing as well as.
I think it's worth stating that the noise to signal ratio in kind of DTA searches and prognosis searches is so far kind of greater potentially than in interventional studies. So yeah, we are all used to the vast majority of what we retrieve actually not being relevant, but in a DTA search and a prognosis search, you really can be actually less than 1% of what you've retrieved is actually going to be includable. It's quite a depressing thought, but having that expectation, I think, is quite important at this stage, unfortunately.
I think it's also useful to warn the authors that expectation, because if they've not done a DTA or a prognostic review before, they are often very surprised about the results of the search strategy and how many, what the result comes out and how much they have to search. So it's useful to pre-warn them of what the expectations are and how few they will find within the search that are true kind of included studies.
Absolutely, yeah.
Thank you. So at this point, thanks very much for all those observations and questions. I'm going to move on just to summarise some of the key points. This is the way that the Cochrane Handbook sort of specifies that you would think about the concepts involved in DTA questions. So it's very much as you've been mentioning already. You've got the target condition that you're trying to diagnose. You've got the participants, the population that you are going to be testing. You've got the new test, the index test, and you've got the gold standard or the reference standard. And these tend to be the concepts that you are going to express in the review question. But then, as with all searches, we may not use all of those concepts actually in the search. In terms of the search term challenges, there are many challenges in identifying DTA studies in a consistent and efficient way. There's a huge variation in the terminology used to describe most tests. There are some nice strategies out there where people have actually shown the huge amount of variation within abstracts of the definitions or the naming of tests like FDG PET. So you end up with multi-line strategies just to make sure you've captured all the many different ways people might have put the terms together. The study design terminology is very inconsistent and again makes retrieval difficult. You are, again, in an ideal world, we want all of the PICO elements expressed in the abstract, but very rarely does that happen. So we have to adapt our strategies to account for that. And also, if you think about the subject indexing in databases, whilst there is a DTA publication type in the Embase database, there isn't a corresponding publication type in Medline. And also, in other databases, the subject indexing for DTA studies is not as extensive as it is for trials. So the suggestions about developing your searches are to, as we've already discussed, try and use as few concepts as possible, and try and think about two concepts ideally. And as Anna has mentioned, the multi-stranded approach is particularly fruitful, I think, in the areas of DTA reviews. And if you do use a multi-stranded search, then as you can see on the right-hand side in green, as you can see in set 4, you could actually think about using DTA filters combined with the index test perhaps as one part of an overall series of searches. So with a multi-stranded search, we have several different approaches, and we then combine the search results together in the final set. So in this case, in set 5. So I'd like us now to think about, we've looked at the search strategy side of things very briefly. I'd now like us to move on to thinking about which resources, which databases and other sources would we search to find DTA studies. So while you have a chance to put things in the chat box, I'm going to invite Anna and Lise to discuss where they found, which resources they found most useful.
I think probably obvious number one candidate is PubMed or Medline, and Embase is the second one. For us in the dementia group, one interesting finding was that a reasonable, more so than for interventional studies, a reasonable number of included studies were only available as conference abstracts, and so Embase was certainly a really important source for conference publications. And then beyond that, I find it helpful to do a search for systematic reviews, other existing systematic reviews in the area, and so I would use Prospero for that. We do also search PsycInfo, Biosis, Web of Science Core Collection, rather. Those are the main sources, and Lilacs, actually, as well, I should mention.
Yeah. No, it's interesting that you're finding Lilacs is useful. That's
Well, I don't know that I would go that far. And that's actually I guess the sort of question in my mind is, we have a sort of set list of sources that we search for our diagnostic test accuracy reviews. We've stuck to it for quite a while. We sometimes branch out into other sources depending slightly on the question. I would like to go back at some point and really look at the yield from each of these sources, because I suspect Lilacs hasn't necessarily produced very many unique studies, but it might have. My sort of impression is that it might not have. So, there is that sort of question around the effort expended to keep searching sources that don't produce unique results. But yeah, I know that for intervention reviews, I think it is an important one to include.
Thanks. I'm just highlighting to the participants that we welcome your observations and questions about resources. I'm not getting any at the moment, but please do tell us about any resources that you found particularly useful for DTA searching, or any questions you might have. So also, Anna, it's interesting that you're talking about Biosis. So there is information in Biosis. Are you finding for sort of the preclinical stage of testing?
Yeah, I think so. I think that's why it initially got added to our sort of list. Again, I would like to kind of at some stage do a bit of an evaluation study on the value of Biosis as part of our set of sources, because added to that, it is one that will retrieve quite a lot of results. So really trying to sort of work out, is this worth another 2,000 results into my results count or not?
Great, thank you. We've got some comments now from the participants. Vera Bora is saying we usually use PubMed Embase in the Cochrane Library. And Carmen Andalucia is mentioning Scopus, PubMed and Cochrane reviews. Samantha Cox, we started with a very, sorry, this is about searching rather than resources. Sorry, Samantha. I'm wondering, apologies, I know this has gone off the screen. I'm wondering as well what you were saying about conference abstracts, Anna. Are you finding the information in the conference abstracts sort of useful, reliable?
Well, that's a good question. So in the past, the approach is that if a conference abstract looks promising, to then try and follow up and find out more information about the study from the trialists or from the researchers themselves. And actually, if I remember rightly, when we undertook our first big program of diagnostic test accuracy reviews, we sort of expected a poor response rate when following up directly with researchers who had, written the conference abstracts and obviously conducted the study. And we got a sort of over 50% response rate back from those researchers, yielding, either confirming the data or providing more data that was needed so that we could include the study in the review. So that was well worth doing. And I think at the time, it was a while ago when we were doing this large program of diagnostic test accuracy reviews, but a surprising number of included studies were identified from conference abstracts, around 10%, which is not insignificant. It could be largely domain specific. We were undertaking a sort of program of work that was looking at biomarkers within dementia. So it might be that, that is just a very hot topic in dementia. There was a lot of conference activity at the time. Perhaps that explains why it proved so fruitful to ensure that we were searching the conference materials.
That's really interesting. Thank you. I'm just noting here a comment from Renato Nietzsche. He says that in physiotherapy, which is his profession, they have a specific database only for diagnostic test accuracy called DETA, and he's put the URL in the chat. So that's really interesting. That's not a database I've heard of. So thank you for that.
It's always exciting to come across a new source.
Thank you. That's great. Okay, I'm going to move on. Thank you very much for all your comments, and apologies to the people that we haven't read out. I'm going to move on just to summarise. As we've already discussed, we usually look for systematic reviews of DTA studies. Anna's noted how useful DTA reviews are for her search strategy development. So we're going to look for DTA reviews in the Cochrane Library, Epistemonicus, Prospero, Medline and Embase. If we're looking for the DTA studies themselves, then Medline and Embase are useful, and of course, and we're also maybe looking in places we don't usually look, in terms of Science Citation Index, Web of Science, Biosis, Lilacs, Scopus, PsycInfo, and of course, other databases that we've managed to identify, such as the DETA database. And if there's also some research that suggests that other search approaches and other options might be useful. So particularly dissertations, grey literature, reference checking, which should be sort of standard in any review, I think, and also citation searches and the related searches options within interfaces like PubMed. So these are approaches we're probably used to using from effectiveness reviews, but they also have a role in DTA reviews. And a lot of this information is taken from a web chapter from the Sure Info resource. So I've given you the link there to the Sure Info chapter, which is updated every 6 months with new research evidence on identifying DTA studies. So I'm going to draw the section on diagnostic test accuracy study reviews to an end. These are just some references if you want to follow this up after this workshop. Thank you for all those suggestions on DTAs, and thanks very much to the panel for talking about that. We're going to now move on in our whirlwind tour of DTA and prognosis study searching to look at prognostic studies. So again, we're going to use the same pattern. We're going to have a brief discussion, a brief set of slides about what prognosis studies are. We're then going to look at what the challenges might be for finding prognosis studies, thinking again about the conceptual breakdowns we might use, the PICOs we might use, and the challenges of finding search terms. And we're then going to think about where to look. So in terms of guidance for finding prognosis studies, there is no guidance in the Cochrane handbook itself at the moment, but there is a really nice newly released learning module. I've given you the URL there, and this is excellent. I've learned a lot from this set of training slides, so thank you very much for the team who've produced those. There are also guidance and resources on the Cochrane Prognosis Methods group pages, and the link is there. And Cochrane has produced some templates for reviews, and I think Anna and Lise will be able to comment on them a bit later on. So there are templates for registering a title, writing a protocol, and writing a review. And there are peer review templates as well. So the first key challenge, I think, about prognosis studies is that there are at least four, I guess, different types. There's a nice series of papers called Prognosis Research Strategy, which goes into quite a lot of very helpful detail about what these types of prognosis studies are and how they differ. So one of the crucial things, obviously, going into your review is knowing what type of prognosis question you're trying to answer. And for the searchers amongst you, it's particularly important because the structure may vary, the structure of your search may vary, and your the eligible study designs might vary. So the four types of prognosis studies, very briefly, are overall prognosis, prognostic factors, predictive and prognostic models, and treatment effect modifiers. So these are just some more information about the different prognosis studies. So the overall prognosis study type is going to be where we look at the risk of a health outcome in a population with a specific condition. So maybe the number of people who have been admitted into hospital and have died within a certain length of time after having had a heart attack, for example. So overall prognosis. Prognostic factors are disease issues that might be associated with disease recurrence or death or some other aspect of the pathway. And prognostic factors studies distinguish groups of people with a different average prognosis. We then have predictive and prognostic models, which are sort of formal tools where multiple predictors have been combined to try and get a sort of an overall assessment of the risk of what will happen to a particular person with a particular condition. So the risk of patient A experiencing recurrence of disease within a specific period. And these models may be presented in the form of named tools or measures. And then the fourth type of prognosis study identified by the Progress series of papers is the studies of treatment effect modifiers and predictive factors. For example, biomarkers that predict whether treatment, how effective a treatment with a particular intervention is going to be in treating people with a particular disease. So this is the different types of study. So bearing that in mind, the fact we've got four different types of study asking quite different questions, I'm going to ask Anna and Lise to discuss the issues of this for searching, but please, if you could put in your own observations into the chat line and your own questions about searching for these types of studies and your own suggestions for what the challenges might be whilst we begin having a chat, and then we can look at your comments and questions. So Lise and Anna, do you think, what do you think are sort of the most common, I guess, of those four types of reviews in your experience? What might people be encountering most frequently? Probably what are the easier ones to be doing that people might do first?
I think that's quite a difficult question To answer these, your group have done a lot. Well, relatively speaking.
Relatively, I think that it's probably prognostic factors and overall prognosis that are the more common ones. Prognostic models, not so much. But I think the key problem before you start defining which sort of study you're looking for is it's really poorly described in all the studies what their study actually is. So it often takes a long time to work out if it is a overall prognostic factor, prognostic model, or looking at effect modifiers, because the authors get themselves confused about what their study actually is. So you've got to work out yourself your definitions of what you're looking for in a study to be able to disentangle what the authors have described as. So you've therefore got to be careful with the filters, because somebody might have described it as a prognostic factor, but it's an effect modifier study, or they might have described it as a prognostic model, but it's looking at overall prognosis. So you can't rely on filters to actually define the type of study that you're looking for, because it's all very confused for literature.
Yeah, I would really agree with that. I only have experience now of 2 prognosis reviews, one a prognostic factor review and one a prognostic model review. But yes, just in developing both those search strategies, encountered, precisely those sort of inconsistent descriptions, seemingly saying one thing but actually appearing to be another. Very tricky. And yeah, it's so similarly with DTAs, not advised to use a filter as an overall limiter for certain, but also just have to have extra caution on how you do use any kind of filtering within the search, even if it's, just part of one of a series of searches within that big search, because as Lisa's just said, there are quite a few filters out there that do exist. They are generally designed for a specific type of prognostic study, and you could inadvertently be sort of limiting what you need to find because, actually the studies themselves are described so inconsistently. So it's a minefield sort of on a bigger scale than even with diagnostic studies, I'd say. And I guess just for me, in terms of when I am developing a search for a prognosis review, I think it's even more important to just engage as early as possible with the review author team about exactly what they're hoping their review is about. Expect quite an iterative process, I think. And I try to include a search narrative with my search strategy to explain how I've got to where I've got to with the final search. And because hopefully then for the peer reviewers, and again, I think that's a really important part of this, get it peer reviewed if you can. It just helps them to kind of understand what you've tried, why you've tried it, and why you've ended up with the search that you have.
Yeah. Sorry, Lise.
Well, I was going to say a key thing as well that Anna mentioned previously was having a list of studies that should be in there as well, because of this issue and testing it, because it is a very iterative process, and often the first couple of times you do a search, some of those studies are missing out just because of the inconsistency within the studies on how they describe themselves.
Yeah.
We've got some questions and comments. So Kit Byatt has said, this is a question, should a crucial aspect of a review be whether predictive factors papers, e.g. open safely in COVID-19, include validation, and comment on how reliable that validation methodology is? So with our prognostic factor reviews, we didn't look at validation of the factors.
Whereas in our prognostic models review, we divided our studies into looking at validation, because Open Safely kind of looked at factors and then went on to say this combination of factors increases your risk of COVID. So they started off with factors and then moved on to creating a model. But you need then, you've kind of got different types of model then. So you have the study where they're developing a model, then you've got internal validation models, and then you've got external validation where possibly the same author group or another author group has tested the model to see if it works with a different data set. To cause even more confusion, sometimes different authors use the same database or a slightly expanded database of the same patients, which you can't do. So you've got to then work out that it's actually the same group of participants. So, but that's probably too much to cope with on this, because it kind of going on to actually how you work out whether it's the same or a different prognostic study. So,
Thank you, Lise. I'm just thinking, going back to what Anna was saying about getting somebody to peer review your strategy. I mean, this is something that is in Cochrane DTA reviews. All the strategies are peer reviewed by an information specialist, and I don't know what the rules are for the prognostic reviews, but I think one of the things that I would sort of suggest we could all do more when we're writing up our search strategies is what Anna was saying, sort of a narrative about why the strategy looks like it does, and the things we may have explored and haven't used, or the things we have explored and have incorporated into the strategy, so that we can sort of explain in a narrative way why it looks like it does. I think that's quite helpful, not just for the searcher peer reviewing somebody else's search, but also for anyone else reading the strategy and trying to appreciate why the strategy looks the way it does.
And just to add to that, I think, and it can be helpful also to include the unique identifiers of the validation set that you've used to develop your search strategy as well. I think I've been asked, sort of, as well as the narrative by the peer reviewers, also asked if they could also have those identifiers so that they can just also test a couple of things to try and kind of eke out that extra bit of precision for me. So yeah, I think it can be helpful to include that as well.
We've got, I think this is a sort of a follow-up comment from Kit Byatt, asking how often are methodologists involved in reviews. I don't know, from your perspective, Anna and Lise?
Methodologists as in experts in prognosis?
Not saying. I mean...
Okay, well, all of our reviews are in collaboration with the Cochrane Methods group. So we have at least one co-author who is a member of a prognostic methods group. I don't think, because they're quite new reviews and there's a lot of technical issues with them, and with some of them you're actually developing methodology as you go along because they're so new, and that you really need good collaboration with the Cochrane prognostic methods group to enable you to get a good quality review at the end. I think it's essential that both DTA and prognostic reviews are complex reviews. They should be done by people who've already got quite extensive knowledge of systematic reviews, and then doing further work on these newer types of reviews and working with the methods groups.
Thanks, Lise. And obviously, this workshop is from the perspective of the searching issues of systematic reviews, and we fully recommend that before that you involve an information specialist and in your review.
Yeah, and instead, getting peer review from another information specialist who's done prognostic reviews before, or DTA reviews for the previous one, would make a lot of sense to make sure that you are creating a search strategy that is sensitive.
Yes, absolutely. Yeah. Thank you, Lise. I'm going to move on now to, excuse me. I'm just going to move on to just summarise the current guidance and current guidance for searching for prognostic studies, bearing in mind that we have the 4 different types. So this is a PICO for the overall prognosis type of study, where you have the population, the outcome you're interested in, which in this example, so the population in this example is elderly people with varicose veins. The outcome is the healing of those varicose veins. You would also be looking for information on the setting and then the time frame, the time to follow up. So the PICO for overall prognosis is suggested might be different to the PICO for prognostic prediction factors reviews and models reviews. So this is much more complicated. There's a lot more going on in terms of the number of concepts involved. So you've got this peacock structure, which involves a number of different concepts. The other thing that's not in the structure here is the relevant study designs that might give you the best quality evidence for this type of review. So for reviews of factors, ideally the type of study design you're looking for is prognostic cohort studies and potentially also RCTs. And for predictive models, it's cohort studies, case control studies, and RCTs. And you don't see the study design in the conceptual breakdown here. So obviously the conceptual breakdown, the research question, what we use from that in the searches is different. We don't use all the concepts necessarily. So this is just some thoughts on, depending on the type of prognosis study, which of the concepts you could potentially search on so that you could build reliable strategies for. So you can see here that some of the issues such as time frame and timing are not really amenable to consistent searching, but other parts of the conceptual breakdown are more searchable. So this is just to highlight the things where you're going to get the most possibility of creating a decent search, and the concepts where you're going to have more trouble. The Cochrane training model is really useful in telling us what we don't know. Prognosis reviews are, as we've heard, new territory. And in terms of knowing what the best research evidence is for searching efficiently, there isn't a lot of information. There hasn't been a lot of research done so far. So guidance for searching studies for Cochrane is underway. A new search filter is being constructed, and there are questions about what are the most useful ways to search for these types of reviews. So the group has noticed that the role of snowball searching is not really, it's not clear whether that's the best approach or a good approach. The issue of searching for ongoing studies through trial registers is an unknown at the moment. We don't know if it's relevant or not to search trial registries. And as with most review topics, people are looking at the role of artificial intelligence methods such as machine learning to try and help us with the challenges of identifying these types of more types of studies where the labelling and the nomenclature is really still not well set out. We talked very briefly about search filters. We're really cautious about the use of search filters for prognostic studies in the sort of setting where they are just a bolt-on to the other parts of the strategy. But it might be that, again, with multi-stranded searches, the use of search filters might be one approach we could use. This is just highlighting some of the filters that are available for the different types of prognosis studies. It's quite important, I guess, to Lise and Anna have mentioned how difficult it is to actually understand what the authors think they may have done in some of these studies. It's the same applies to the search filters, trying to figure out if the search filter is really finding the types of studies that you want to find is quite challenging. But this is what they say they're looking for. And you can see just from analysing the sensitivity and precision of some of these filters, you can see that they are probably, even in their own right, not many of them are performing well at the levels we would want for filters for systematic review purposes. And what you can see here, for example, the fourth one, the second filter along is the Haynes sensitive filter. And what you can see here is the drop-off in sensitivity when the Haynes filter, for example, was validated in a particular second gold standard set of relevant records. So with all of these filters, there is a drop-off when they're used in the real world. So the previous one was for studies, for prognostic factor studies. This is performance of filters for prognostic models. And again, you can see the Haynes Broad one, where the third one along, where sensitivity drops off in validations. With search terms, we face, I've said the usual challenges with term inconsistency. I think we have probably even more challenges in terms of term inconsistency for prognosis studies. And we clearly have all sorts of challenges with finding some of the study designs, because the study design terminology is not standardized either. And I think we don't know yet, but I think multi-stranded searches are going to be potentially useful in this field as well, given the fact that a simple two concept combination is unlikely to be sensitive enough. And we need more research in this field. What are effective ways of searching for prognosis studies? So I thought we would now move on and just talk very briefly about what resources we would search to find prognosis studies. Again, please let us know from your experience, participants, whether you've found useful resources beyond Medline and Embase. And I'm going to invite Anna and Lise to talk about whether they found additional useful sites, useful resources for identifying prognosis studies.
So for me, it's the same set of sources that I'd search for diagnostic test accuracy studies, but perhaps with a little bit more emphasis on trying to identify other relevant systematic reviews. So again, Prospero and Epistemonicus are useful. And Prospero, actually, you can sort of filter by diagnosis or prognosis reasonably nicely, so it's quite a quick way of identifying potentially relevant systematic reviews in that area. I think I would be interested to know if people had thoughts around the value of searching trial registries, because at the moment we haven't got that as one of our sources for prognosis reviews. And yet, of course, potentially there could be usable data within a range of designs, as we've heard. So I wonder if that's an area that needs more exploration, or if people have thoughts on that. And I guess my final point is I feel like with prognosis searches, probably more so than with any other that I've had to work on, I think there's a sort of increased need for what we call kind of supplementary searching. So you've got your standard list of databases that you search, but there might be sort of increased importance in backward-forward citation checking, potentially hand searching, and certainly asking experts in the field for their ideas around known studies that we might not have been able to capture through our more standard database searching. So I think those are my main messages at the moment, where I'm at with my prognosis searching.
I think from the clinical trials registry, more prognostic studies and cohorts which are looking at prognostic factors are being registered. So although it may not be a good source at the moment, the number that are being registered is increasing significantly, and I think it will be a good resource for the future, especially the studies that tend to be better designed, to have more funding, and actually probably be higher quality.
Mm-hmm. That's a really valuable point. Yeah.
Thank you. I'm realising that we're running perilously close to the end, so I'm just going to press on. Thank you very much there's a couple of questions there. Thank you for those. One question is about whether we can share the slides. I'm not sure what the organisers are doing, but if they don't share them with you, Samantha, just send me an email, or Anna or Lise. So I'm just going to I'm going to just summarise where the current evidence is on where we should look for prognosis studies. All the usual places, as Anna's mentioned, Medline, Embase, and also research by Sekula has suggested that grey literature and conference proceedings might be worth looking at. Other options that the researchers suggested include, as Anna and Lise have mentioned, forward citation searching, systematic review reference checking, and Sekula has also mentioned theses as well. So there are some references on the slides as well. I realise we're going to be cut off in a couple of seconds, so I'm just going to do a final check to see if there's any final questions. I think this might be quite a nice final minute question to end on, Lise and Anna. So Renato Nietzsche has said, do you think that artificial intelligence and machine learning models can improve the diagnostic, prognostic and risk factors accuracy using the big data from hospitals and clinics?
Yes.
Yeah.
That's a very brief and distinct answer. Thank you.
I think it will be incredibly useful. I think that the drawbacks are that routinely collected hospital data is often very messy. Mm. So it's going to be a work in progress. It's going to take time, but I think it will be a fantastic resource for the future.
Thank you, Lise. So I'm going to end now because I don't know when we're going to be cut off. So thank you all for participating. Thank you very much to Anna and Lise for being lovely panel members, and I hope that's been interesting. And as I said, if you want the slides and they aren't provided by the organisers, then please just email one of us and we will send them to you. Do hope you enjoy the rest of your day, and thank you for your attendance.